Hey guys, my name is Dr. Jenny Liu. I'm a board-certified dermatologist, and if you struggle with these tiny flesh-colored watery bumps along your fingers that itch like crazy and literally make you want to dig your skin out, well, guess what? You're not alone. I also get this myself sometimes, and I see this a lot in clinic on my patients. So today we're going to talk about what this condition is, why it occurs, and what you can best do to treat and prevent it. And by the way, the condition is called dyshidrotic eczema. So if this sounds good to you, I would love it if you can give this video a thumbs up. Don't forget to hit that notification button and subscribe to my channel if you enjoy learning more about skin and hair care related content. So dyshidrotic eczema, the other term you may have heard it being called is called pompholyx eczema. It's one of those types of eczema that really just affects the hands and the feet. And even with eczema, there are so many different variations, and dyshidrotic is just one of them. Now, because hands and feet, the skin is very similar, conditions that can affect the hand can also affect the feet or both. Even in one individual, you can just have one location or both being affected. And dyshidrotic eczema typically presents as like watery, flesh-colored, blistery bumps along the fingers, toes, palms, and soles. And they're characterized by this intense itch. And one of the first things that patients come in telling me is like, I am like weeping from my hands. I have like these blistery fluids from my hands. And what's happening here is that it is so itchy that when they go to scratch, it breaks open the vesicles and the blisters. And then the blisters will kind of dry up, crust over, even flake off, or even crack over time. So the name dyshidrotic eczema, dyshidrosis, is really a misnomer. When we first discovered this condition, it was thought to be due to abnormal sweat gland function, maybe even occlusion or inflammation of the sweat glands, but that's really not the case anymore. Dyshidrosis, then if you break down that name, it means like abnormal sweating. Hidrosis is sweating, dyshidrosis, abnormal sweating, but really is not due to abnormal sweating. Dyshidrotic eczema is just a type of eczema, and with all types of eczema, we really don't have one true cause. It's multifactorial. Eczema just means inflammation of the skin. The most common type is atopic dermatitis, but there is dyshidrotic eczema. There's even like nummular eczema. There's allergic contact dermatitis, irritant contact dermatitis, and there's so many different types. But what we do know is that with eczema, there's often a genetic predisposition, so making one's skin a little bit more vulnerable. And then two, external factors. You really kind of need to have that perfect storm to get eczema. And so at the heart of eczema, all type of eczema is really a weakened skin barrier dysfunction. So, it could be due to genetically you're born with dry skin, or it could be from just external factors like you're washing your hands, overusing your hands. So in fact, one of the most common causes of dyshidrotic eczema is in people that already have pre-existing eczema elsewhere. And I actually see a lot of dyshidrotic eczema in individuals that use their hands as like for work. And so occupations that includes like say hairdressers, cooks, cleaners, that often subjecting their hands to wetness, so to a lot of water, to certain maybe allergens or chemicals that may irritate their skin and break down their skin barrier. And then other things would include like fragrances, fragrance skincare. Metal can be a trigger. So metal allergies like nickel and cobalt are two of the most common types of metals that can trigger allergies or are highly allergenic. And then stress. Stress sounds cliche, but definitely is a big trigger. And actually for me, that is one of the personal triggers. So when I'm flying a lot, when I'm under stress, I definitely get more itchy bumps on my hands. And then changes of environment, changes of the season. We typically see eczema more so in the wintertime just because it's so cold outside. But dyshidrotic eczema, ironically, I actually see it more so in the summer. It could be due to that humidity. And for a lot of people, humidity and heat can actually be a trigger for their eczema as well. So it just depends on the individual, but that is kind of one of the rundown of common causes of why it may happen and occur in some people. So how can you treat and maybe prevent dyshidrotic eczema from happening? Well, first and foremost, just like any type of eczema or dry skin for that matter, you really want to just take care of your skin. Obviously, hand washing is kind of that necessary evil. And if you need to wash your hands frequently, definitely recommend picking a gentle cleanser. And I've actually talked about this trick before where I actually love, especially in the wintertime where I live, it's so cold and dry outside, but we need to wash our hands to, avoid getting sick. Sticking with a actual cleanser for your face that is gentle yet effective at removing the bacteria, the buildup of like dirt and other debris. So I actually really love using cleansers as hand wash for myself and for my family. So there are a lot of great gentle cleansers, and actually what we do know from hand washing is that it's really the act of lathering and the physical lathering of during that 60 seconds, right? That is key at removing the bacteria. It's not really the antimicrobial, antibacterial agent in soaps. In fact, we know that a lot of these antimicrobial agents, there's quite a bit of resistance. So it's really the act of lathering and washing your hands that truly matters. So I recommend going with a gentle cleanser that lathers nicely, but with ingredients that also helps to minimize the drying effects of hand washing. So for example, La Roche-Posay, their body wash balm is great. It provides great hydration, but yet lathers nicely. At the same time, is nourishing. So it contains ingredients like shea butter, niacinamide, La Roche-Posay's thermal spring water, and glycerin. So that is a really nice one. I also really love Cetaphil. They have one that is called the Gentle Foaming cleanser that really foams nicely, so you get a good lather, but at the same time it's not stripping. And if you really want to pick an actual hand wash that's gentle, one of my favorite is actually from Dove. Dove line makes one that comes in a pump, and it's the one for sensitive skin that lathers nicely and does have antimicrobial ingredients, but at the same time also moisturizing and hydrating ingredients, so it's not going to be overstripping your skin barrier as you're cleansing your skin. 2, moisturize immediately after each hand wash if possible. And this is where do whatever works for you, but I literally have a moisturizer just like all over my house. I have it in my bathroom next to my cleanser. I have it on my kitchen counter. I have it, in my upstairs bathroom, in my bedroom, literally in my bag, anywhere, so that way it's within arm's reach and allows me to have easy access. And if you have a desktop, keep it next to your computer. If you're running around a lot and don't have a desktop, maybe putting it in your purse or even keep it in your pocket. There are lots of good moisturizers that come in various different sizes that hopefully make it easy for you. And there are a lot of great ones. You don't actually need to get a hand-specific moisturizer unless you really want to. But like say, even just the CeraVe moisturizing cream, something thick that will kind of coat your hand, but not super greasy. I think that one is great. That this one is really rich and nourishing, but at the same time, not going to be really oily and make your hands super slippery. It contains 3 essential ceramides along with niacinamide, hyaluronic acid, and petrolatum to effectively kind of support and seal in the moisture and help your skin repair. La Roche-Posay is another great product. They have Soothing Repair Eczema Cream that I really love that also contains 1% colloidal oatmeal that is soothing and calming, along with shea butter, niacinamide, glycerin, and their thermal spring water. And the other trick you can do is do an extra repair at night when you're sleeping. So do what's called like a soak and smear method. And this is a trick that I actually teach my patients with hand dermatitis is at night, because we are using our hands so much during the day, getting moisturizers or even getting medications on your hand during the day may not always be possible. So take advantage of when you're sleeping to repair your hands. So soak your hands in lukewarm water until they're kind of damp and wrinkly, pat it dry, put on a good layer of moisturizer, and even slug with like petrolatum if you can, and then get a pair of cotton gloves, put your gloves over that, and literally sleep in that. Next day when you wake up, your hands is going to be so much softer and smoother, and really helps to effectively and quickly repair any damaged skin, any cracked skin. I love this trick for not only hands but also feet. Now, as far as like what to slug with or what to use, you can use plain old petrolatum. I also really love Aquaphor. That one is great. Aquaphor does have great petrolatum ingredient, glycerin, panthenol, but does also contain lanolin, which is derived from sheep wool. So if you have lanolin allergy, then you may want to just stick with plain old petrolatum or try something like CeraVe healing ointment. I personally find that texture-wise, CeraVe is actually the lightest. So you can either go with that because you don't want something super thick, or I actually love CeraVe healing ointment actually slugging for my face. But anywho, anything with petrolatum based is great as sealing in that extra moisture. And my recommendation is with the soak and smear method and wearing the glove is to actually, after you soak, when your hand is still damp, put on a good moisturizer. That moisturizer often contains additional ingredients to help repair a skin barrier, or even your medication first, then moisturizer, and then lastly the ointment. So legitimately you are slugging for your hands or your feet or both, and then cotton glove and cotton socks on top of that. As far as gloves go, I mean, literally what I recommend to my patients is just getting like a cheap one from like Menards or Home Depot, ones that you are using for like raking leaves in the fall, something super cheap, and just use that every night when you're sleeping. You don't need to wash it often, because any sort of coating that is coming off on the inside, it just becomes additional layer of ointment when you reuse it the next night. So wash it like once a week or a few times a month. But the whole idea is that the glove is meant to seal in any moisture, any of the products, and basically keep it on your hand, so that way it can more effectively stay on your hands and do a better job of repairing your hands and feet as you sleep. So that gentle cleansing, moisturizing, and even kind of that slugging with gloves and socks is a really neat trick for helping to instantly repair any inflamed skin that's mildly inflamed, or say even if you don't have hand eczema but want to repair your damaged skin or have fissured fingertips or heels. That is a great way to quickly repair your hands. But say if you really have itchy skin, what can you do? Well, cooling compresses, cold compresses, whether it's like kind of submerging your hands in cool water for a period of time, or using like ice pack, can instantly kind of distract that itchy sensation. And then also over-the-counter hydrocortisone ointment or creams can be helpful, but I do often find that's not enough, because frequently when I'm seeing patients in clinic, they've said, I've tried hydrocortisone, it doesn't work because it's just not strong enough. But certainly while you're waiting to see the dermatologist, or if you can't immediately see a dermatologist and you're just so miserable, these are the things you can do at home. The last thing you really want is to scratch like crazy. Even though scratching does give you relief, the more you scratch, the itchier your skin actually becomes. It can actually worsen the eczema. But two, scratching breaks open skin, it gets crusty, and then it can actually lead to secondary infection. So cool compresses, icing it, and cortisone creams, they're really intended to distract you, so that way you don't itch your skin and lead to secondary infection and worsening of that eczema. Now, say if you've done all of that and it's still really itchy and miserable, you're not alone. I mean, this is why I see patients in clinic, because most of the time they've come in telling me, I've tried literally all the over-the-counter skincare moisturizers for eczema. I tried cortisone, I tried anti-itch creams, it's not working. This is where we can help, because often with eczema like this, it does require prescription medications because they do work better. And as far as like what we prescribe really depends on kind of the severity and also what the person does. For some individuals, when they need to use their hands a lot, it is very hard to keep topical medications on their hands unless it's overnight. And so this is where we would have a conversation with the patient to figure out what is going to be the most effective, but also what makes sense for their occupation and their lifestyle. But topical steroid creams are going to be the mainstay for treating hand and feet eczema, mostly because they're very safe to use long-term and they work really well, especially for individuals that just kind of have intermittent breakouts or localized breakouts. So here, my favorite is actually prescribing something that is much higher in strength. So usually like mometasone or clobetasol or fluocinolone Ointments. I really love ointments because ointments, they don't burn. They also work better because the ointment itself, that ointment is more occlusive and so make the medication work better. Creams, especially when the skin is super inflamed, can burn. Ointments don't. So this is where I love prescribing something that's ultra potent because the hands and the feet, the skin is actually pretty thick. So this is why hydrocortisone over the counter don't work as well because it's just not strong enough. So my favorite go-to is like mometasone or clobetasone ointment. And I ideally would like to have the patient apply it twice a day, every day until the rash is gone. And then trying to take advantage of that glove trick to really keep the medicine on their hands for at least a couple hours during the day, and then overnight if possible. And that is one of the main challenges, like I said, of treating hand dermatitis is because we use our hands so much. Anything we put on our hands, medication-wise, like, we put it on, but if you're going on your keyboard and typing or immediately you're cooking and washing your hands, it doesn't have enough contact time to work. And so this is one of the challenges and why hand and feet dermatitis is just so hard to treat in general because of that factor. But yeah, topical steroids is a mainstay that works really well and it's very safe for most people, even moms who are expecting because they're just using it locally. And so that is what I like to prescribe. If they're really itchy, sometimes we may even prescribe anti-itch pills to help them sleep at night. So Benadryl or hydroxyzine. And for really bad cases, like say somebody's going out of town and they really need to get it under control. I don't like to do this, but for that kind of emergency use, I will prescribe them like a course of prednisone to quickly calm things down. Prednisone is basically oral steroids. It works really well, but long-term is not ideal. It can have rebound, meaning once you finish off that prednisone, sometimes the eczema can come back and sometimes it can come back with a vengeance. So this is where we would have a conversation, what makes sense. If the patient's going out of town, but they're super miserable and needs to get their dermatitis under control, we may do like a brief 1 to 2 week course and then kind of talk about maintenance or minimize ways for that, do things to minimize that potential flare. Phototherapy is another option that is really nice. Unfortunately, phototherapy is usually done in office, so it does require the patient coming in 2 to 3 times a week, but it is one of the safest options that can work really well with good skincare and topical medications and effectively controlling the hand dermatitis, but does require a lot of, say, time on the patient's end to come in. You can certainly get a home light box. That can be really expensive. Insurance don't always approve of it, and you kind of have to prove that it works for you. So this is where, if it does work for the patient, but they can't put in that time commitment to come in office, but the light therapy, they've tried it, works well, then we may work with the insurance trying to get them like a home hand unit to treat the dermatitis at home. And then lastly, if they have tried all of that, but it's still really severe, and I've definitely seen a lot of patients with really severe hand and foot dermatitis, this is where we talk about oral medications, long-term oral medications that may be safe, or even biologics and injectable medications that can be helpful. And one of my go-to ones that can be really life-changing is an injection called dupilumab or Dupixent. This is really approved for eczema of all sorts, namely atopic dermatitis, but I've used off-label for hand dermatitis, hand eczema, and it can be very much life-changing. It is an injection that patients would give to themselves, and it's relatively safe in this sense. Majority of the oral medications that we prescribe, because eczema is an inflammatory condition, the treatments work by reducing inflammation, and how you reduce inflammation systemically when you're taking these medications is it does suppress your immune system. So that's always one of the concerns. But dupilumab or Dupixent is one of the least immunosuppressive. In fact, when we prescribe, we don't really even check any labs. So it can be very safe. Certainly all medications have side effects, and this would be one where you want to talk with your dermatologist about the potential side effects and make sense for you or not. But of all the medications out there that can work really well, work quickly, and is relatively safe and not as immunosuppressive, dupilumab is definitely one of them and has been life-changing. Otherwise, aside from dupilumab, other things we could do be like, say, methotrexate I prescribe for individuals, cyclosporin, azathioprine. Those are a little bit scarier because they are more immunosuppressive and are used in medicine for other things too. We definitely use it in dermatology, but they're often kind of used commonly for organ transplant, so really reducing the likelihood of your transplanted organ being rejected, so purposely immunosuppressing the individual, and that is something that obviously we talk about with the patient if, say, dupilumab is not an option or not covered by insurance. But just understand that there are a lot of options available, all the way from topicals to in-office treatments to injectables, as well as oral medications that can work really well. Is just having that conversation with your dermatologist to figure out what is best for you, but also what is going to be covered by your insurance. You also want to make sure to see a dermatologist, aside from the dyshidrotic eczema not improving with home remedies, is when you notice the crusting becomes really yellow honey colored, or say it goes from itchy to being painful. That could be a sign that it is super infected, or impetignized is the term that we use medically. Essentially, when your skin breaks down and it's weepy and oozy, it basically is a port of entry for bacteria and can definitely get that skin super infected with commonly staph bacteria. So this is where seeing a dermatologist, swabbing to see what bacteria is growing, giving you appropriate either topical antibiotic ointment or oral medications is going to be the most effective. And I also strongly discourage you guys from just empirically treating with Neosporin or triple antibiotic, because those two are actually two of the most common allergens triggering allergic contact dermatitis and could potentially flare your dyshidrotic eczema. So this is where a dermatologist can prescribe you an antibiotic ointment that's not going to cause that problem. So certainly if you already have pre-existing dyshidrotic eczema, you may be worried that you are getting super infected. You don't want to use Neosporin or triple antibiotic. What you can do is actually do dilute bleach soaks. That is actually a trick I recommend to my patients with eczema, more body-wide eczema, to do in the tub, but dilute bleach. And you guys can look up how to do this dilution. And I'll also make sure to link few credible sources from the National Eczema Association, where it actually gives you the actual dilution amount, and you can kind of modify that for hand soaks. But dilute bleach is anti-inflammatory and antimicrobial, so it is very safe to do. Just make sure that you're using regular bleach, not ultra concentrated bleach, and following that ratio. But essentially it's kind of creating a little chlorinated pool, I tell my patients when they're doing full body soaks. And we go swimming, it's very safe, it's the same idea. But that bleach can definitely is shown to actually be a great complement to your eczema treatment regimen in reducing not only inflammation, but that bacterial burden, but also reducing and treating mild infections at the same time. All right, guys, so I hope you found this video helpful. I haven't done this type of educational video in a long time, but I've been seeing a ton of this type of eczema, so I thought it'd be helpful to make a video like this. And if you enjoy content like this, please let me know in the comments below what other derm conditions you want me to talk about next. As always, any questions you have, let me know in the comments below. Be happy to answer them in a general way. As you guys know, I can't provide personal medical advice on social media, but always happy to answer any general questions. And then I will also make sure to link the products as well as some good resources below as well for you guys. As always, thank you so much for watching, and I will see you next time.